Okay, that's awesome. So I can hold on to unless. That's fine. Yeah, I just don't know if one of them is here. So. But that's fine. I'll just if they come see me, I'll let them know to do. Okay. Was it you, Shalane? You were clear on my instructions. I couldn't remember who it was. Thank you. All right, so I want you to look over this packet here that I just handed out. And so on these first pages, this first little packet here is from our respiratory therapy department. And so they usually are able to come in and show you guys a chest test, but it didn't work out for them to come this time. But I do at least want to give you the information that they normally provide. So a lot of it, as you kind of flip through the packet, it kind of goes through the same thing we have in our document, but it kind of goes into a little bit different detail. But what I really like is this front part. We definitely talk a lot about diaphragmatic and pursed lip breathing moving into the fall semester too. So I want to go over those with you guys first. But also this kind of talks about controlled coughing and how you go about doing that specific with your patient, which we go into a little bit more in the fall. So I'm going to kind of skip that, but it's good information to have, at least like introduce you to it. So on this first page is where I'm going to start. So you guys already know about pursed lip breathing, right, from last semester. So what is that? How do you do it? I love how I just saw you guys start doing it. That was great. There. Okay, so what is our little saying that we use for pursed lip? Smell the roses, blow out the candles? No? Did you guys hear that? Okay, so that's usually the common saying. So you say smell the roses and blow out the candles. Don't say smell the candles, blow out the roses. I hear that a lot. I bet somebody's going to do it in the lab exam too. Every year I swear I hear it. So I'm like, okay, there's some scented candles as long as it's not burning. Anyway, so you're breathing in through your nose, fully, right? And then you blow out through your mouth. And as you blow out through your mouth, how long, is there like a general rule? It should be twice as long as how long it took you to breathe in. What's that?
I feel like Brent said something like 2, like he had the number 2 in there somewhere, and it was like 1 to 2 or something like that.
So it's twice as long. So you just want to make sure that they're really expelling as much as they can when they exhale. And so pursed lips is really how you're going to do that with blowing out your air. So I want to see everybody doing it real quick. So breathe in through your nose. Blow out through your mouth through pursed lips, twice as long. That's like 4 times as long. That works. That's fine.
Satch is going to pass out.
Well, remember, there's still a lung air left in the lungs. What is that called, actually? What is it called? Yeah. Residual volume. Yeah. You still have air in there. Yeah, you're not going to completely get rid of all of it. So, actually, let me go. So, what is the amount of air you can control from full inhalation to exhalation? This is too soon. Vital capacity. I'm all vital. Yes, vital capacity is what you can control. Okay, so we would use pursed lip breathing when we're working with a patient to improve their exercise tolerance, okay? So a lot of times throughout therapy is when you're gonna do it. So when you greet a patient and start introducing yourself, if it's a patient that, skilled nursing or really requires a lot more with, awareness to their lungs, I would usually start off saying, okay, this is who you are, you're doing your full introduction, you're doing your vital signs that are necessary for that patient. And then you would go into, okay, I'm gonna teach you a breathing technique, because it kind of relates to vitals. So go right into teaching them about pursed lip breathing, and then use it consistently throughout your therapy session. So as they're taking a break, if they have to sit down, you're gonna have them do pursed lip breathing again.
And this is specifically like with a lung patient?
No, I mean, I used it every single patient, but I also worked in a skilled nursing where respiratory complications are usually present in more of the elderly population. If you're in like outpatient, probably not as much, because they're probably not needing it, unless there's a specific patient that is short of breath more often, then you would use it.
So could you, for the pursed lip, could you do it by time? So like if you breathe in for 5 seconds, you're breathing out for 10?
You
Or-
can, but it's usually not that specific. It's kind of more of a general. So you can kind of judge it based on how they're doing it. If they're like quickly breathing, then they're not doing the technique correctly. Okay. So pursed lip breathing you already know about. Did you know about the diaphragmatic breathing? Did you learn that? Okay, so that's what we're going to get into next. Now, with diaphragmatic breathing, the way that you would introduce this to a patient, so think of the same patient I just talked about. So I greeted my patient, I did vitals, I taught them pursed lip breathing, and I've used it consistently throughout my treatment session. Now, if they're really needing more work on their diaphragm, so I always tend to go to like the stroke patients or the neurotype patients because that's what I work with all the time. But think about that for just a second because it kind of relates here. So if there's a stroke patient, one side's usually affected. That means their diaphragm's affected as well. So I want to increase the amount of, it's a muscle, so I want to build the strength of that muscle, right? And so the way that I'm going to do that is by introducing diaphragmatic breathing, and I'm usually going to do that at the end of my treatment session. So I'm going to have them do it like a home exercise program, okay? So as I finished up, and now I'm going to go through and get them all set, maybe back in bed, and then teach them this, okay? And I want to say, I want you to do this several times throughout the day to help to build your diaphragm muscle, okay? All right, so place one hand on your stomach and one hand on your chest, okay? So you're still going to use similar to what you did with pursed lip breathing as far as breathing in the air and expelling the air. You still want to do this same type of process, but this time you want your belly to expand. So it's kind of like belly breathing, okay? This is what you're teaching. So, that was good. Okay, so as they inhale, what should happen is this hand on your chest should not move. The hand on your belly should expand now, okay? So take a deep breath in, and as you're doing that, push all that air out through your stomach. Make your stomach really big, like a pregnant belly. Okay. And then when you go to expel the air, you're going to have that expel through the belly, right? So the chest is still staying nice and neutral, but you still want to do twice as long, okay? So work on that a few times. Sorry, they're very entertaining. Okay, I just wanted you to get a good feel for that. Now you would also be involved with this with your patient. So you might have them place their hands here and then you place your hands there too, or maybe they don't place their hands at all and you're placing your hands and then you're making sure that they're doing it correctly. Now one of the things you can add to this, if you are turning it into an exercise, is like a progressive resistant exercise. So as I expand the belly, I also, when they go to exhale, I'm going to press on the belly to try to expel, like make them go faster, but they need to control it. So it's putting resistance on the diaphragm. What kind of contraction is that? Like if I'm having them control it on the exhale? Is it a concentric? Is it an eccentric?
Eccentric.
It would be an eccentric contraction. So slowly control that on the exhale.
Eccentric contracting the diaphragm.
Yep. So that's how you can kind of think about progressive resistance. So first off, I'm starting off with them just doing it. And as I want to work on increasing the strength of that diaphragm, that's when I might add some resistance, okay? And that's all based on your amount of resistance, your manual resistance. You're not gonna get a theraband out or anything. Okay, so any questions on the two of those? And when you would use them? No? Okay. So that just goes into the detail of how to do it. Like I talked about before, the controlled coughing, we are going to talk about the coughing like this more with spinal cord injuries. So I'm going to hold off on that for now, okay? But we will talk about coughing specific for these techniques. The rest of this, like I said before, this has the image that I put in your notes. If you printed prior, it's right here, okay? And then it goes into a little bit more detail as far as what respiratory therapy information they had. Okay, and then it talks about different hand positions as you would do it for cupping or clapping versus vibration. So flat hands for vibration, that's what we'll talk about here in lab. Okay, so now I'd like to reference to the last pages that I gave you guys, or the last page is kind of separate. So the front of it kind of shows the different positions from your notes. And then the back of that page shows, like, if we're talking about the upper lobe, the lower lobe, like, what does that mean when I'm looking at the body? This is a better visual of what that means, okay? So if they're lying on their side, if they're on their back, so it's the front of the body, the back of the body, the side of the body, okay? So at least that'll give you a better understanding of what that looks like when you're looking at these pictures here in a little bit. Okay, the one I'm going to demonstrate for you guys right now, just to show you the technique, I think I'll do the upper lobe posterior segment. So find that on your page here. I want you to know how to look for it, so first find that. Upper lobe posterior segment, so it's the top row, the middle one, okay? You see that? Okay. So, Maria, can you get me a pillow? And then, Satchel, you want to be
Sure.
So you're doing so good. Thank you so much. You're welcome. Okay, so come on over here, Satchel. And you guys can gather around. I hope these pillows, they're getting pretty small. What I'm gonna have you do, so what I'm looking for him to do is position him just like this picture. So he's seated and he's gonna like hug the pillow by leaning forward. And I don't want you to lean forward too far like it does, like it specifies an angle, like don't get your goney out. Like it doesn't matter that much. But I'm gonna have you hug this, kind of hold on to it and just kind of lean forward when I do this. Do you care, do you have any problems on either side?
The
Like
back?
where, like right at the top here?
No, we should be good.
Like, so what are some of the contras? What's that?
Or the ribs.
Oh, you
Yeah, flail chest, if there's fractured ribs. What else? Heart failure, it's kind of a general idea of that. I just want you guys to kind of have that in mind as you're doing this. So you have none of those contras.
Well, another one would be like opening
Yeah.
wounds and
Once
stuff.
you inspect the skin, so you don't have anything,
What about, gosh, I literally said it last week.
I can tell.
Yeah, that one, yeah.
Yeah, so that, what is that?
Where it's shifted to one side.
Yeah, so it's kind of like where you're getting into collapsed lungs, which is also like pneumothorax. So you probably wouldn't be doing this with somebody like that. I mean, there's going to be other complications that are probably more of a medical priority than getting into expelling mucus. But there are certain types of like bronchiectasis. That one's like buildup of mucus. That is like an indication for why you would do something like this.
You didn't have surgery to your eyes or your brain recently, right?
Okay,
Hope not.
so I'm gonna choose to do right over here. Is that all right?
Yeah.
You don't have any injuries right here. Do you?
No, that's where that knot was the
Oh,
other day.
That's
Like right on my
Christina?
small boy right there.
Really fast too. When it says severe hypertension, how severe are we talking?
I think you're gonna end up seeing like with your PT, with the doctor, like there's gonna be a lot more involved than here's a number to go off of.
Okay.
So I can't really give you like a specific.
So
I mean, there's definitely like stage 2 hypertension, that would probably start putting it there, but there's gonna be a lot more conversation involved in that, so.
So if they just have like blood pressure issues, it's not necessarily,
Yeah.
oh,
No.
we can't do it,
Right.
we just need to.
Okay, so let's run through some of the techniques real quick. So what do I start with as far as what it said in your notes that we discussed? How would I start? What's that? So not necessarily, so that's when we start going into soft tissue massage, which doesn't really relate so much with this part, so I don't need to do effleurage.
So just starting with percussion.
Yeah, so what do I have to do first, though, with him?
Wash your hands.
Yes. That is great, yes, that is absolutely true.
You need to make sure he's.
Yeah, so position him appropriately, and how long would I hold him in that position?
10 to 15 minutes.
Yes, oh, good, you listen to me. So 10 to 15 minutes, and then that allows for draining.
And that's before you even do anything.
Mm-hmm, yep. So I'm not gonna let you just hang out there for 10 to 15 minutes, I just wanna run through.
We're like, let's watch.
Yeah, let's all
Sit there for
hang
10
out, stare at
minutes.
him.
Make sure he
So
doesn't move.
he would have, that's where draining would start, and then I would get into what? What technique? Yeah, so this is where I get into percussion, and so I'm gonna do my clapping, okay? And then what would I do after I've done that for a little bit of time?
The
Vibration.
Yeah, so then I'm gonna get into vibration, and so vibration, I'm gonna put one hand on top of the other, and I'm just gonna show them real fast on you, on your shoulder, is that all right? So what I'm doing here is kind of fast, it's like a shaking, right? I'm shaking. But I'm doing like a fast oscillating type motion. And then as I'm doing this, he's gonna be hissing, okay? And so I'm doing that based on how much he can expel with his hissing sound. And then once that's done, you guys are all gonna do this here in a second too. So it won't just be you, Satchel. So once he's done there, then I would go into what? Is that your answer? Because that is right.
She gave an example.
Yes. So then I would have him go through a cough after that. So to see if what I've done has moved anything. Okay? So you're gonna have like a good cough, not like a good one. Okay?
Christina, in the notes it said vibration was like faster and then shaking was
Yeah.
a little slower, so
Yeah.
can you
It
show us
It does kind of separate it in the notes, but I'm gonna. It's funny because I talked to our respiratory therapy department about that, and they're like, no, it's really the same.
So you
Okay.
don't really have to go slower? Okay.
So vibration and shaking are very similar. It talks about the amplitude of movement on one versus the other, but they're like, and then just put it together. So, and I will definitely believe what they say because they're the ones that do it all the time. So this is not something that I would normally be doing, but maybe on occasion. Okay, so any questions on the technique of how we would go about doing that? Okay, so when I'm ready to do this, Satchel, that's kind of how it's going to go. So I'm going to start with kind of doing this motion on you, okay, on this part of your back right here. So you said there's no injury except for that little knot there, which could be helpful. And then after I've done that for a little bit, I'm going to have you take a deep breath in, as much as you can do. And then once you're at the top of that breath, I want you to hold it there. And then I'm going to have you expel by doing like a snake sound. Okay. As much as you can do while I'm kind of shaking you. Okay? So I want you to go all the way to the end of what breath you have.
Okay.
Okay?
Alright.
Does that make sense?
Yeah. We might have to do it again, but
Okay. And then,
Am I doing it in this position?
yeah,
or-
you will be, yeah. So once we're done with that, then I'm gonna have you take, or do a deep cough, okay? So, and then once you cough, I have a trash right next to you, so if you need to spit anything, or I have the towel right here, if you need to use that. Please, don't- your laundry friends would not like you very much.
Well, I'm doing laundry this week, so it's all
Oh,
good.
okay,
I'm okay with mom. You can-
So you do what you need to do, okay?
Have you ever actually had a student like productive?
Vomit?
No.
Okay.
Vomit? No. No, and actually, I'm so sad to tell you that they brought the chest vest in before, and I've had students try it, and even with that,
They
no.
didn't do anything.
No.
Okay.
I mean, they kind of started coughing a little bit, but nothing was like actually moving around. So, but I don't know that they were sick. We could try on Eric. That's what you were saying before. We're not
Get all
sick,
that.
but just like a little congested, right? Anybody else feeling like that? Oh, right on. She's been
Half
sitting
the
here
room.
coughing. Yeah, all of you are gonna start feeling so much better after today. Okay, so I'm gonna have you kind of lean forward if you can, and then that trash is right near you. Okay. I'm like, wait a minute, it's going too far. Okay, so based off of this picture here, I'm trying to identify that. So it's the upper lobe posterior segment, and so again, if you need any other reference material, you can go back to that picture from your notes, which is now in that packet, or you can reference on here as well. But for me, I'm gonna go right here to get that posterior segment. Okay, are you ready? So I'm starting off with doing what? So he sat here for 10 to 15 minutes, right?
And you could do any of the concussions, right?
The one that we're gonna just do cupping or clapping. Does it feel okay? Not like hurting you. And it should not be like a smack, like you're keeping, it's really in the cup that I'm not having to put a lot of force into this, okay?
And do you genuinely do this with like the shirt on?
If you have something, I would expose the skin so you could see if there's any areas of injury. I would put something over it, like a pillowcase or something, and do it just like that.
Oh, okay.
I was watching a video and they were saying that there's like a small vacuum that's
Mhm.
created because of the company.
Exactly.
Kind of cool and
All right, so I'll stop there for a sec. Now what I want you to do is take that deep breath in, as much as you can do. Now hold that, and now start doing an S sound, like a snake sound, all the way.
Wow.
You're doing a good job. Okay, now I want you to cough, like a big cough. That was not a good cough. Okay,
I'm so
and then I would go through the same sequence repeatedly. Okay, you good?
Yeah.
That was a really good hissing, like you made me work.
I know, Christina's like, when is this gonna be over?
I know, I'm like, stop already. No, I'm just kidding. No, that was really good. So you would do that same technique for all of these different positions. Now, where you can sit up now. There are certain ones that I want you to be aware of. So let me point out the right middle lobe. So look at that on your page. I want you to get a feel for where that red mark is located. Okay, so you do have females in this class, and even males, it can be an uncomfortable spot. So you are gonna be right at the top of the tissue. Now, if there's anywhere that you need to go that like sits underneath or to the side, like the lower lobe, the anterior basal segment, that one kind of comes off to the side. If tissue gets in your way, you can ask your patient to move it, okay? as far as so you can access the area a little bit better. But this middle one is not directly over the top, okay? So just make sure that you're finding the lobe segment, okay? And especially when they're positioned Trendelenburg.
Oh,
So keep that in mind too. So it's depending on how tissue falls, you might have to come underneath too to access that a little bit better. Okay? All right. I just want you to be aware of that. Don't be shy about it. Just talk to your partner to get a good feel for where it's supposed to be. As far as positioning, not all of our beds do Trendelenburg. So, and there's a lot that's like that. I want you to try to do what you can with the beds that we have. Now the bottom part does lift, so you can try to access Trendelenburg as much as possible. Use of pillows, use of those, can't I think of the names? The
wedges.
wedges, thank you. Gosh. Like I can't think of my words. You can get the wedges out and use those to position appropriately. Now around each of these, I have it labeled for you, so I definitely want you referencing back to this to say, okay, do I have everything specific to what this picture is showing as far as pillows, where are the legs, where are the arms, where's the head, everything, okay? And then make sure you're on the correct side to target that specific segment. Does that make sense? All right, is that a question?
Yeah.
That is. Yes.
I just asked a lot of questions.
She's like, I don't really want anything to hear.
So, for somebody like if they are laying on their side or supine and you have like the trash, so after when you say cough, are you having them like roll?
They will have to move and then go back to that
So,
position.
but not sitting up.
They might need to. I mean, the whole point of it is to try to get a good, like, whatever's coming out, you want to get them up so they can spit that. So that is the purpose. So if what you did is enough to get that, then great. And then you just get them repositioned back down if you're going to continue.
So when you finished with satchel and you were done vibrating and you
Mhm.
said cough, so between the vibration and the cough, would you help them sit
Yeah.
up and then say, okay, now cough?
Yep.
Okay.
And if they can do it, like, just by rolling to the side and get a good cough, or if they really need to sit up and do it, then help them up. Okay, so we're going to count. Oh,
Sorry,
question.
I just
Sorry.
have a quick question. With like productive cough, I know
Uh-huh.
you said you might get like infectious.
Yeah.
Like you're trying to get that type of sputum out, but what if you get like pink frothy sputum? Like, is that like a contraindication?
That
It's
would
just-
not
it's one of
be,
the-
I would, like, if that were you as a PTA,
Yeah.
you would want to go directly to nursing or your PT and say, this is what I'm
Cause I was like,
Okay, so let's go with partners. So we're gonna, I'm missing two, so we should still have, what do we have? 16. All right, so 1.
1,
2,
3, 4, 5, 6, 7, 8,
1.
5, 6, 7.
Okay, get with your partners. And go to each, just find a specific station. Now there's 2 up here.